Go ahead, ma'am.
Good afternoon. This is Dr. Gayatri Satpathy here. I am consultant at Oasis Fertility at Bhubaneswar. In today's Facebook live discussion, we are going to deal, or I shall be sharing with you few important tips so that you can choose or you can know which is the best fertility clinic for you. So in India, there are nearly 27.5 million couples who are struggling with this problem of infertility. Now, infertility is when you and your partner have been trying for a pregnancy since last 1 year and you have not been able to conceive. See, having a baby is an incredible experience. However, there are few couples who face difficulty in conceiving. So, in record in India, we have around 27.5 million couples, but the actual number may be much more than this because there are so many couples even in rural areas and other places also who are not even reporting to the hospital. So, the actual figure is much more. The incidence of infertility is rising. At least 10 to 15% of the couples are struggling with infertility. Now, when you are dealing with this problem of infertility, you're not able to conceive. So, then the next thing that comes to your mind is that you now need to go and see a fertility clinic or visit a fertility doctor. In bigger metro cities like in Hyderabad, in Chennai, Bangalore, Delhi, Kolkata, you have multiple fertility centers in a given city. In tier 2 cities, for example, I am based in Bhubaneswar, and other tier 2 cities, there are limited fertility center options. In both of these scenarios, one where there are many centers and also when there are limited number of centers, you're always confused as to which doctor should you visit, which fertility center will be best for you. So, to deal with this, in this video, I shall be sharing with you what are the important parameters that should be in your mind, which will help you to decide which center or which doctor you should go and visit. So, the first is the experience of the clinical staff. So, whichever fertility center you have thought that you are going to visit, you should see to it that there are well trained fertility experts as well as well trained embryologists who are available. Apart from this, the nurses and other support staff, the counselors who are going to be with you in your fertility treatment, they are also well experienced with this fertility treatment. So, whenever you have a well experienced staff, and when this is coupled with a good and high quality laboratory, both of these will together give you a very good success rate. The second is that the important parameter is whether the clinical environment is patient friendly or not, which means that whenever you are visiting a fertility center, just talk to the people around there, starting from the receptionist, to the nurses, the counselors, the doctors. Even you can talk to the embryologist and feel how do you feel when you talk to them. They should be patient friendly. The doctor should be able to give you time. The doctor should be able to answer all your queries. So these things are very important because whenever you are starting your treatment of infertility, multiple visits are required. There is a lot of stress involved, and during this journey, if the overall experience becomes patient friendly, you feel less stressful there. So then your success rate also improves. The third important parameter is approachability, which means that the just take into account how much time it will take to reach the fertility center. Because whenever you are starting a fertility treatment, you require multiple visits. So you should make sure that what is the time which is involved and whether this particular center is well connected via cabs or auto or buses, whether the fertility center is nearby the railway station or airport, because there are also couples who come to us from other cities. So you should also take into consideration the travel expenses and the time that is going to be involved. The fourth important parameter is the facilities offered and the different technologies which are available in the fertility center. See, most of the well-established fertility centers generally have most of the facilities under one roof. For example, in our center, we have the facilities for ultrasound, we have facilities for blood tests, urine tests, we have facilities for getting your IUI, IVF, and ICSI, all the routine fertility procedures. Apart from this, we also have facilities for surgeries like laparoscopies and hysteroscopies, which are required for enhancing the fertility outcome. Apart from this, there are also nowadays advanced fertility treatment options. Also, for example, we may have to do PGT, which is a genetic testing of the embryo. Sometimes there is a testing of endometrium also required, which is called as the ERA test, endometrial receptivity array. And then there are other advanced procedures like blastocyst culture, vitrification, cryopreservation. So find out if all these facilities are available. You can know regarding these by discussing these things with your doctor and the embryologist. So if everything is available under one roof, then the things become more easier. You don't have to go to multiple places for small things, and your time is also saved. Now, the next important parameter is whether the particular fertility center is transparent and ethical. Although I'm telling you it towards the end, but then this is the most important one. The transparency and the ethical part should be well maintained. So whenever you have been, suppose there is a fertility treatment that has been assigned to you need to understand completely the in and out of the procedure, which means that you should have a complete discussion with your doctor regarding the details of the procedure, any risk associated with the procedure, whether there are any complications associated with the procedure. So that part should be transparent. Secondly, you should also understand the financial part. Even if it's a basic treatment that you have chosen or with advanced treatments like IVF ICSI, the cost structure also should be known so that before you are starting your fertility treatment, you are prepared not only physically or mentally for the treatment, but also you should be prepared financially so that you are less stressful during the entire procedure. And the other important thing which I want to highlight is that you should make sure that the confidentiality of the records is being ensured. So whatever is being discussed with your doctor, so those records should either be within the electronic system or it should be within the hospital records, and no third person outside the hospital should have an access to these records, and that is very important. And the final part which you can take into account is the success rate. But remember, it is very difficult to exactly tell what is the success rate of a particular center because success rate is not generally center specific. The success rate is most of the times patient specific. Let me explain you in very simple language. For example, in a particular month, I have many patients who generally are having a good prognosis. That means they are they were easily able to conceive. So then in that particular month, definitely the success rate is going to be very high. However, in a particular month, if we have many couples who have a lot of problems, they are older age, they have very low egg count or very low sperm count, so then the success rate will be less. So in that particular month, the success rate can be low. So success rate is always a patient specific thing. But yes, when if the particular fertility clinic has well experienced staff, a good doctor, it has got a very good lab, so then also your success rate will improve. So talk to your doctor regarding this, like what was the success rate over the last few months. You can also discuss with your friends and peers and your family members and get suggestions regarding the success rate if they know about. However, always remember there can be few fertility centers who claim as 100% success rate. So remember that these are false claims because any treatment whenever has got a particular success rate. No 100% success rate treatment is available at present for solving the fertility problem. So, in short, I think I would like to summarize it as that and every fertility journey can be very overwhelming, it can be stressful, you may be anxious. However, if you partner with the right fertility clinic or and a right fertility doctor who can guide you well, you can be able to achieve your desired success more smoothly with less stress, and the end result is going to be more better. So I hope these few parameters you will note down and you will consider whenever you are choosing a fertility center. And hope this was useful. And I thank everyone who has joined in this webinar today. And if there are any questions, I would like to answer them. So how many visits are required for the IVF procedure? Yes, so see, normally in an IVF procedure, you require multiple visits. The whole process of an IVF generally takes somewhere around 6 to 8 weeks. And in this 6 to 8 weeks period, you may require at least 15 to 20 visits to the hospital. The initial part of the IVF, where you require daily multiple injections, so that part is around 10 to 12 days. And after that, when you come for the embryo transfer, you require at least 3 to 4 visits. And over a period of 6 to 8 weeks, generally an IVF process gets over. What is the difference between IVF and ICSI? So there's a very small difference between IVF. So initially it was IVF which was done, and now ICSI is slightly more advanced procedure, and the basic goal is the same. In IVF, what happens is when the egg of a female is taken out from her body, it is cultured along with the sperms of her husband. naturally one of the sperm, the best sperm, will go and fertilize the egg. In the ICSI procedure, the egg of the female is directly injected with the best sperm in the lot artificially by the embryologist. So the sperm is injected inside the egg artificially is called ICSI, and in IVF this is done naturally. The ultimate goal is that the egg has to be fertilized and embryo has to be formed. So I think these were the two questions which we got now. And if there are any other questions, you can always ask in the comment section, and we will be happy to answer. And for any other queries, you can also dial to our helpline number. Thank you so much for attending this live today.